We've all been to school, we all have plans and goals and dreams, and we all want to succeed. We all have things that need to stay organized, and we all have deadlines. These things were constants in school and remain throughout life. We learn skills to deal with these aspects of life when we're young, but for some kids, it's not that easy. My name is Sam Flaherty, and I'm a student at Western Carolina University studying occupational therapy and psychology. And today, I'll be talking about the use of occupational therapy in schools and why it's necessary for the success of every student, not just in the classroom, but in life. I've analyzed a video on YouTube talking about what an OT does in schools and how what they do helps students who have various ailments and differences. First of all, what is OT? Well, occupational therapy is a healthcare profession that helps in the rehabilitation or development of people young and old who have physical, cognitive, and social issues. These can include cerebral palsy, executive functioning disorder, autism, Down syndrome, sensory processing disorder, blindness, deafness, burn scarring, loss of limb, and many others. There are many different diagnoses that an OT can work with, and at every age. An OT's main goal is to help aid in the improvement of participation and satisfaction with home, work, and community life, according to UNC Chapel Hill. While occupational therapists that work in hospitals or clinics may work with their patient on skills that may seem more of a necessity for survival, an occupational therapist in a school may work with these skills to a lesser degree, but their primary focus will be to help the students succeed in school. So they'll most likely be working with students on problem-solving skills, organization, time management skills, emotional regulation, things like that. I analyzed the video on YouTube by Ask OT Settings, which was about 12 minutes long. When I was watching this video, I was really concerned with two things. One of them, was it entertaining enough to keep me engaged when learning about OT? This is where the different modalities come into, which I'll talk about the lighting and the videography, things like that. And two, did I actually learn anything as an OT student? Could I take away anything? So let's start off with the first question. Was it entertaining? In short, yes, it was. There was a lot of jump cuts to B-roll that I found to be pretty nice to have, especially when the OT was showing off a certain tool. Some of those tools were scissors that you could squeeze that would spring back, that would help with if you didn't have good fine motor skills, or a pen that would strap to your finger that you would have to write like this instead of going like this. I thought that was really nice. They also had some graphics posted up, which was really nice to have, some visual. What I didn't like so much was the audio and the video. It felt like it was filmed in a closet, to keep it blunt. The microphone was too far away, and it sounded very echoey. Also with the video, it was pretty dark, and the background wasn't very engaging. It was just a gray background. What I think they should have done is bring it into a classroom. There's your background right there. What I did like about the videography was the close-up shots. It was very well lit. They had different things on the table. It was very intriguing to look at. It was very nice. And the second question, did I learn anything? I would say when it boils down to it, yes, I did. However, it was more of OT in school versus OT. And I think that comes into the fact I've been wanting to be an OT for a few years now. I've done a good bit of research. I went to OT when I was a kid, so I feel like I already had some knowledge going into it. But I feel like I did learn something as an OT student. I think I did learn something about OT in schools. To wrap this up, I think that the video was a great way to engage people about learning about OT. I think that the main demographic for the audience was people who are studying occupational therapy or are curious about it as a profession they want to go into. And B, parents who are curious about OT in school, like what does it look like? What is my kid going to be doing? Things like that. All in all, I think the video was great. When it came to teaching about OT, I think the modalities were using different modalities were pretty good. The use of the graphics, the use of different angles was very good. It kept me entertained, and I walked away learning something. So, yeah. Someone outside talking about terrorism. That's weird. Anyway.